This video will describe the first interprofessional oral health core clinical domain risk assessment. This 5-part video series is part of the Consortium for Oral Health Systems Integration and Improvement Project that is funded by the Health Resources and Services Administration's Maternal and Child Health Bureau. As a reminder, the 5 interprofessional oral health core clinical domains are listed here. Project teams that are part of the Integration Learning Collaborative are required to address all 5 domains as they work to integrate oral health care and primary care during prenatal visits. According to HRSA's integration of oral health and primary care practice document, as shown to the right and linked at the bottom of this slide, Domain 1 risk assessment identifies factors that impact oral health and overall health. The competencies for primary care providers in this domain are to conduct patient-specific oral health risk assessments on all patients, identify patient-specific conditions and medical treatments that impact oral health, identify patient-specific oral conditions and diseases that impact overall health, and to integrate epidemiology of genital caries, periodontal diseases, oral cancer, and common oral trauma into the risk assessment. As another reminder, primary care teams that are part of this learning collaborative are required to complete Smiles for Life courses 1 and 5 at a minimum by August 31st. This slide shows screenshots from Smiles for Life, course 5, that reviews oral health risk assessment, including individual, behavioral, and environmental societal risk factors, as well as race and ethnicity factors. This is another screenshot from Smiles for Life that includes information about the oral health risk assessment and screening process for pregnant patients. It includes 2 questions that can be used to standardize the oral health screening process. Some things to consider with your project team. Consideration number 1, at what prenatal visit will oral health risk assessment occur? To start, only select 1 prenatal visit. You can scale up and add additional visits later to repeat oral health risk assessment with your pregnant patients. It is recommended for oral health risk assessment to occur early in a woman's pregnancy, ideally during the first trimester. Identifying a specific prenatal visit to integrate oral health risk assessment will help with consistency across team members and will ensure that data can be collected more efficiently. Consideration number 2, which provider or providers will conduct oral health risk assessment? And could the patient answer questions while waiting to be seen to make the process more efficient? Consideration number 3, will a specific risk assessment tool be used or developed? And what questions will be included? We'll show some examples in just a minute. Consideration number 4, will the responses to the risk assessment determine a score for the patient's risk? How will the responses to the score inform next steps, such as fluoride varnish application, oral health education, and referral? Consideration number 5, how will oral health risk assessment findings be documented in the electronic medical record? How will you track and report how many risk assessments were completed each month? And now for some oral health risk assessment examples. Let's start with the National Consensus Statement, which is linked at the bottom of this slide. The National Consensus Statement states that an oral health history should be taken during the initial prenatal evaluation. This information could be gathered via conversation or questionnaire. Below are some questions that you could consider asking your pregnant patients and integrating into your EMRs. As a reminder, some of your states also have your own state oral health care during pregnancy guidelines. So we'd encourage you to consult these documents as well, in addition to the National Consensus Statement. As part of the Partnership for Integrating Oral Health Care into Primary Care project from 2019 to 2021, the Maryland team developed 6 questions on the left of the slide here to ask during initial prenatal intake visits. Answers to these questions informed oral health education given and dental referrals. To the right on this screen is a tool that was developed by the Illinois project team. This tool included contributing conditions, anticipatory guidance, services that were provided, and referral information. Both of these are included in the final project report linked at the bottom of this slide. On this slide are resources from the American Academy of Pediatrics Protect Tiny Teeth project. On the left is a prenatal oral health screening guide for providers that also includes oral health history questions. To the right is a prenatal oral health information form that was developed for pregnant patients to complete. Based on responses to the questions, the number of A's, B's, and C's are tallied. These results feed into a conversation guide shown here that provides helpful discussion points for provider-patient education and discussion. These resources are linked at the bottom of the slides. And now for documentation in the EMR. The next 3 slides share examples of documentation of oral health risk assessment using structured data fields within certain EMRs. This example is for a child in Athena and shows open comment boxes to document oral health risk assessment information. This example is from NextGen that includes mostly yes, no boxes and answer choices and various answer choices for frequency of toothbrushing. And this final template from Centricity includes all domains except domain 3, preventive intervention, or fluoride varnish, as well as a population of interest section that includes categories for hypertension, diabetes, age, and pregnancy trimester. So this template includes every domain except domain 3, all in one place. And this final slide shows the project measure related to this domain. The measure description is the percentage of pregnant women who received an oral health risk assessment during a first and/or second trimester visit by a primary care team member. The denominator for this measure is the total pregnant women seen for the specific visit your team decides upon during the month. The numerator is the total pregnant women with a documented oral health risk assessment during that specific visit by a primary care team member during the month.